Good afternoon everyone. So my presentation is on navigating odontogenic cyst in pediatric population a case series. So as you know, odontogenic cysts are common jaw lesions in adults that arise from the remnants of the dental tissue and impact the dental development. However, in the mixed dentition, they will be complex and the diagnosis will be difficult because of the root resorption of the deciduous teeth and eruption of the succeeding permanent teeth that led to a confusion between radicular and the dentigerous cyst. So in this paper, I will be presenting two interesting case reports of pediatric odontogenic cyst and discuss the diagnostic challenges and the management strategies that we encountered during the mixed dentition. So moving on to the case report, a 11-year-old male patient came with a complaint of pain and swelling in his left upper front tooth region for the past 4 days. The swelling, which was initially small in size, gradually increased to the present size, followed by the pain, which was sudden, intermittent and aggravates on touch. There was no past medical history. And the external examination showed a diffuse swelling which was evident on the left upper half of the face, and on palpation it was firm, tender and surface warmth was felt. Internal examination showed well-defined swelling which was evident on the attached gingiva in relation to tooth and the labial obliteration was noted, and on palpation it was firm, tender and compressible in the anterior aspect. There was clinically missing tooth 3 and grade 1 mobility was noted in tooth 2 region, and the provisional diagnosis we gave as radicular cyst in relation to tooth 2 and differential was unicystic ameloblastoma and anterior maxilla. We followed with the X-ray investigations. In OPG, a well-defined unilocular radiolucent area was evident in the periapical region of tooth 2, covering 2/3 portion of the root, that is impacted tooth 3, which is displaced superiorly into the maxillary sinus, and displacement of the root was evident in tooth 2 and tooth 4 region. The coronal tip of tooth 3 was impinging the root of apex of tooth 2 and tooth 4. Then we went on with the CDCT, and in axial section it showed expansion and erosion of the labial cortex from tooth 1 to tooth 4 region, and an uncommon finding of well-defined hypodense area with the central hypodense area extending from the crown into the root of maxillary left lateral incisor was noted, which is suggestive of density in relation to tooth 2. In the coronal section, erosion of the buccal cortical plate and thinning of the nasal floor and perforation of the maxillary sinus wall and displacement of tooth 3 with mucosal thickening was noted. So, with these findings we did a literature research and diagnostic workup and searched many articles regarding the dentigerous cysts associated with the pediatric population and found a similar case report as of our case, which showed dentigerous cysts associated with radicular invaginatus, which is nothing but dense in denti, which can affect both primary and permanent dentition, and the prevalence of 1.7 to 10%, and males are more commonly affected, with maxillary lateral incisor being the most commonly affected teeth. So what is the clinical concern of this is that the risk of developing pulpal pathology and the invagination, it communicates with the oral cavity, allowing the entry of irritants into the pulpal tissue, and blots suggested that the resultant periapical inflammation will spread to the involved follicle of the unerected permanent successor, resulting in the dentigerous cyst formation. So most of the patients will be asymptomatic unless the infection occurs, which was the positive finding in our case also. And according to Ben and Altany, the dentigerous cysts were most common in the anterior maxillary region because the mandibular third molars were not observed in most of the children. So with these findings, we gave the radiographic diagnosis to be dentigerous cyst involving tooth 3, and FNAC was done, blood tinge aspirate evident, and the report came to be cystic fluid with acute inflammation. And these were the surgical pictures. Cystic enucleation along with extraction of unerected tooth was done, followed by peripheral osteotomy, and the histopath report came to be dentigerous cyst. This is post-op-pic. Moving on to the second case report, 8-year-old female patient came with a complaint of swelling in her left lower back tooth region for past 15 days. The swelling which was initially small in size, gradually increased to present size, and in this case there was no pain associated with the patient, and she gave a history of restoration that was done before 4 years in her left lower back tooth region. In the external examination, there was a diffuse swelling in the left lower back tooth region, and on palpation it was firm, non-tender and non-compressible, and the regional lymph node was palpable but not tender. Internal examination revealed a carious lesion in 7-5 tooth region, but there was no mobility and non-tender. In intraoral, there was a solitary swelling in the region of 7-5, which was ovoidal in shape, and on palpation it was firm, non-tender and non-compressible. With this, the provision was given as dental caries in 7-5 with intraoral abscess, and differential was Gary's osteomyelitis, and we followed with the regular investigations. In OPG, there was a well-defined unilocular radiolucent area involving the periapical region of 7-5 with a smooth margins without a radio-opacum, and center to the radiolucent area there was a radiopaque structure noted which is suggestive of crown of the unerected 3-5, and there was evidence of radiolucent area involving enamel dentin and pulp which was in 7-5 suggestive of dental caries with pulpal involvement. Then in CBCT, well-defined hyperdense area noted involving the 7-5 region. And in coronal section, there was erosion of the buccal and the lingual cortical plate and erosion of the superior border of the inferior alveolar nerve. So with these findings, we did a diagnostic workup, and in this particular article, they said that more than 70% of the patients with radicular cyst